We've reached the final presentation in our nursing process theory. We've gone through the steps of assessment, coming up with a nursing diagnosis, identifying our outcomes, and then making a plan based on those outcomes. Now that we have a plan, the next step is to carry that plan out, and that is the fifth phase of the nursing process, or the implementation phase. Implementation really refers to the action phase of the nursing process. It's when we initiate the plan, we record our nursing actions, and its purpose is to provide technical and therapeutic nursing care to help our clients achieve an optimal level of health. Carrying out this implementation phase really requires the development of several different skill sets. One of those skill sets has to do with technical competence, that hands-on ability, the ability to use equipment and know how to use the equipment properly. Another skill set that's very important to develop is your cognitive or intellectual ability. This is the problem-solving or decision-making aspects of our nursing care. And finally, in implementation, we need to be tapping in to our interpersonal skills, those communication skills that we need to develop with our clients, the ability to demonstrate caring behaviors. If you spend a little time reflecting on yourself, you may think of one of these areas as maybe more natural for you, or maybe a couple of them are more natural for you. Many people who go into nursing have strong interpersonal skills already, and so maybe that's an area that is a little more natural for you, but maybe you're not quite as technically competent. Whatever you do when you are defining yourself and looking at yourself here, you want to realize that all of these skills are things that we need to develop, and they're going to all be developed through practice. You're going to spend a lot of time in the laboratory and then in clinical settings where you'll be doing technical skills. You'll be developing that hands-on ability. Again, for some of you that'll come more naturally than others, but we all need to work on developing those skills. In your studies, you'll be really developing that problem-solving and decision-making cognitive or intellectual skill set. And that's something that you're going to continuously add to as you continuously learn and use the nursing process. For others of you, you need to spend more time working on those interpersonal skills. Maybe you're a strong communicator, but you tend to talk too much, as we talked about earlier. And you need to work on your listening skills. Maybe you're a shyer person, and it is more difficult for you to demonstrate those caring behaviors. It's all fine. As you reflect on yourself, just think about what are those skill sets and how do I need to work in each one of those areas to develop myself more as a nurse. The activities that are part of this implementation phase of the nursing process are listed here. One thing to keep in mind is that we are always reassessing. We're always looking for new information, so we never take off those assessment glasses as we are moving through the nursing process. As new information arises, it may mean new priorities, and we may need to reset our priorities. Obviously, performing the interventions, carrying out the plan, is part of this phase, as well as making sure things are well documented. If it isn't documented, then legally it wasn't done. And so that's something to keep in mind. Is an important part of the implementation is to be recording our actions. An important distinction that we need to keep in mind as we're thinking about our nursing interventions is to distinguish between those that are independent nursing interventions and those that are collaborative or dependent nursing interventions. Independent nursing interventions are based solely on the nursing diagnoses that we have, and those, as we've talked about, are responses that nurses are licensed to treat by virtue of their education. That is going to include some interventions that can be delegated. Those might be delegated, say, to a CNA, or maybe to physical therapy or someone else in another area, but it's still the nurse's ultimate responsibility to see that that intervention is carried out. In contrast, We often are engaged in nursing interventions that are collaborative or dependent, and that means that they are not solely under our jurisdiction, but a physician's order or a primary care provider's order is required in order for us to carry out that intervention. Let's remember, though, that as nurses, we are still responsible for our actions in the interventions, whether those be independent nursing interventions or whether they are collaborative or dependent. The sixth and final phase of the nursing process is the evaluation phase. Evaluation is a systematic and ongoing process. When we are evaluating, we're judging the effectiveness of the nursing care provided to meet our client goals or outcomes. So that really involves comparing the patient's health status currently with the outcomes that were defined by our plan of care. In other words, we look at the effectiveness of our interventions and evaluate that in relation to the outcomes. We ask the question, have the outcome goals been met? This is very important, and you will discover that more and more as you move forward in the program. There is a tendency for nurses, when they get to an evaluation stage, to be evaluating ourselves. And so we have a tendency, instead of keeping that focus on the patient and saying, has the patient met the outcome goals? We have a tendency to look at ourselves and say, did we do what we said we were going to do? Did we follow through? And that's the wrong focus here. Remember, we want to keep the client as our focus. So we want to be asking the question, have the outcome goals been met? So we look to the outcomes and not look at evaluating our interventions. So when we ask the question, was the outcome goal achieved, there are a number of different answers that we can come up with. One answer is, yes, the goal was completely met. Another answer might be, the goal was partially met. Or maybe the goal was completely unmet. There's a table in your textbook that shows you some clinical examples of this that you can spend some time looking at. But those are our answers that we can come up with when we ask the question, was the outcome goal achieved? If the answer is no, that the goal was either partially met or completely unmet, we might need to just continuously reassess, and we might find new data that would reveal that our outcomes were perhaps not appropriate. Maybe those outcomes weren't smart enough, not specific, measurable, appropriate, realistic, or timely. And in that case, we need to change them and set more smart outcomes. Maybe we might need to look at the outcomes and stage them a bit, set them at increasing levels of difficulty. So for example, we might have a patient that we want to see ambulating over a certain period of time. We might want them to walk 10 feet with a walker by day 3 and then walk 20 feet with a walker by day 5, etc. So we would be staging that outcome out. Maybe the problem is not with the outcomes, but the interventions were not appropriate. Or maybe those interventions weren't realistic. So we may find that maybe the outcomes were appropriate and the interventions were appropriate, but we just need to continue things a little longer in order to achieve our outcome. Or maybe we need alternative interventions. Maybe we need to add to our plan. Sometimes we might find out that it was a very appropriate intervention and an appropriate outcome, but the interventions were not being carried out correctly. So, for example, we may have nursing staff that require more education so that an intervention can be carried out appropriately by them. Or if this is an intervention that's being carried out by the patient themselves or perhaps a family member, maybe they need to be retaught about how to do that intervention correctly. This flowchart, which comes from your textbook, just gives you all the information that I've just talked about in a flowchart format. You can see at the top it starts with collecting, analyzing, and synthesizing the data for evaluation, comparing that data against outcome criteria. And as you can see, if you go to the far left column, that would be a situation where the client responds as expected, and our answer to the question, was the outcome goal achieved, is yes, the goal is completely met. In that case, we delete the nursing diagnosis from active status and then periodically reassess, but that's no longer an active problem for that individual. In the middle columns, you can see the line that talks about the goal being partially met. And then to the right, the goal completely unmet. And you can see in that situation, we need to reassess the situation, perhaps reformulate correct diagnoses, make a new plan, implement, and evaluate at that point in time. So you can see the cyclical nature of the nursing process, where in fact the evaluation leads right into a reassessment, and we're right back at the top of our loop. In the right-hand column, it reminds us that oftentimes when we're doing evaluation, something brand new has arisen. We have a new problem that leads to a completely new diagnosis. And in that case, again, we're going to modify our plan of care. So this brings us to the close of our overview of the nursing process. We will use this problem-solving framework as a tool to examine our role as a nurse throughout this course and throughout the nursing program as a whole. Now, as we move forward through different fundamental topic areas, the nursing process will provide the structure for our learning and will ultimately be a significant guide for your professional practice.